Okay, so first I'm going to perform my hand hygiene. I'm going to knock on the door, provide privacy. Hi, I'm Maddie. I'm going to be your student nurse today. Can I just get your name and date of birth? Great, I'm just going to check your wristband. That matches up. Can I just have some verbal consent for this exam? Okay. So today I'm just going to be doing an abdominal assessment on you. So before we get started, do you need to use the restroom? Or do you have any pain in your abdomen? No? Okay, great. So you're already positioned at a 30-degree angle, but I'm just going to have your legs supported. So I'm just going to have you put your legs up, please. Thank you. And I'm just going to be exposing your abdomen. Your arms are by your side, so I'm just going to expose your abdomen. So I'm just going to lift this up and cover you with the drape. Okay. So the abdomen's exposed. So I'm just going to inspect the abdomen. I'm looking for abnormalities in the skin, contour distension, or structural abnormalities. So I see no lesions, rashes, ecchymosis, no surgical scars. There's no striae, no umbilical herniations, or dilated veins. So her contour is flat and symmetrical. And I'm going to look for peristaltic waves, pulsations, or piercings. She has none of that. And she doesn't have any abnormal hair distribution. So now I'm going to auscultate the bowel sounds in the 4 quadrants. So starting at the right lower and working up counterclockwise. So using the diaphragm, I'm placing it directly on the skin. I'm going to go in an S shape. So I hear positive, active bowel sounds in all 4 quadrants. Next, using the bell of my stethoscope, I'm going to place it directly on the skin in the 4 quadrants. Oh, I'm sorry. I'm going to start at I'm going to be listening for bruits. So at the aorta artery, the renal artery, right and left, iliac, right and left, and femoral. So I hear negative bruits. Now I'm going to be percussing the 4 quadrants in an S pattern, and that's going to be including the liver and the spleen. So again in the S shape. So I hear tympany in all 4 quadrants, and I did hear liver and dullness over the liver and spleen, which is normal. So now I'm going to palpate lightly over the 4 quadrants. So going about an inch deep in the S-shaped pattern again. Going in the same pattern. So I felt no tenderness. So when I let go, did you feel any tenderness? No, so no pain, no rebound tenderness either. So now I'm going to palpate deeply in the 4 quadrants with 2 hands. So I'm again going in the S-shaped pattern, going counterclockwise, starting at the right lower quadrant. Okay, so I felt no tenderness or masses. Did you feel any pain? No. Okay. So now I'm going to palpate the right upper quadrants and the left upper quadrants. Okay. So I'm going to feel for the liver and then the spleen. So I'm unable to palpate liver and spleen. So now I'm gonna palpate the CVA. So I'm just gonna have you sit up, please, while I look at your back. Okay. So I'm gonna assess the kidney tenderness by just tapping. So she felt no pain, so no CVA tenderness bilaterally. Thank you.